Ladies and gentlemen, this past week at the Appropriations and Revenue Committee, the budget director was with us, and he outlined the proposed budget by the governor. And among the questions I asked him was, why do we have an increase of 82% in the administrative cost of the expanded Medicaid program? This was an additional expenditure of $188 million, ladies and gentlemen, during the second half of this fiscal year. Evidently, this addition is due to the Medicaid waiver that was approved by the Trump administration recently and is now being challenged in court. No other state has done this, and evidently the Trump administration wants to use Kentucky as the model for setting up guidelines for those in the expanded Medicaid program and other Medicaid recipients to work or volunteer or be in some type of a training program so that they can deserve the Medicaid coverage. Ladies and gentlemen, this program administratively promises to be very complicated, and for those who are using the expanded Medicaid program or even the existing Medicaid program before the expansion, this promises to actually be a threat to many of them in sustaining their health care coverage. The other question I asked the budget director had to do with who is going to administer the complicated regulations and set up the computer system to manage it. God forbid that Deloitte will do this. Ladies and gentlemen, Deloitte was the one who established Benefine 2 years ago. And we all know that Benefine was a total train wreck in the Cabinet for Health and Human Services, Family Services. It threw people off benefits. It caused them great agony. It caused them to spend repeated visits, make repeated visits to their local offices to restore their benefits. I find it ironic that a governor who wants to cut red tape and who wears a little button with red tape being cut on his lapel is now establishing all this red tape for working poor people and poor people with disabilities and poor people who are struggling to keep body and soul together, to establish more red tape for them to get what I believe is a human right. It is a human right, ladies and gentlemen, for all of us to have health care. And if you don't believe that, then I have to question your humanity. Because none of us can live without health care in this competitive society. We all must have it to sustain our lives and to sustain our families. Now, what this governor and this president have done is to essentially demonize poor people and say, you are defective in some ways, and we're going to have a social engineering project to correct that. We are going to have a social engineering project to guarantee that you pay something to society for what we're giving you. Ladies and gentlemen, our problems stem from our acceptance of this filthy, rotten system. And this filthy, rotten system creates poverty in this state. And now we're going to punish those who are the victims of this filthy, rotten system? It's immoral. It's a shame. I will tell you that a blanket policy requiring poor people to in some ways earn vision coverage, to in some ways earn dental coverage, or in some ways to sustain their medical coverage, that this procedure will actually throw off of the Medicaid rolls nearly 95,000 Kentuckians who will be left without any health care coverage, who will be open to suffering and death or bankruptcy or all of the above. because we have set up red tape for them to have their Medicaid coverage. Now, I will say that there are some people who, under this scenario, are simply unable to do the work requirements, job training requirements, volunteer requirements, make the co-pays, make the premium payments, simply because their lives are too chaotic. Or they may have mental illness that prevent them from doing this. You're going to take a young man I know who has agoraphobia, who is on the Medicaid expansion program, and you're going to say, now, go out into society and volunteer for 20 hours a week, or go to a training program so that you'll have job skills. We're not guaranteeing there are any jobs after you get skilled. Or you're going to go out and get a job for 20 hours a week. Can't do it. So what's going to happen to people like that, who simply are not capable emotionally, psychiatrically, to fulfill some bureaucratic red tape in order to sustain their health care coverage? There are a lot of questions right now. This has never been done before in the United States of America. So we're going to be the guinea pigs. And it's a shame, because we have some of the poorest health numbers in the nation. And we're going to make those even worse by establishing this additional red tape. Ladies and gentlemen, it's important for all the stakeholders to sit down and get the facts about what's going on. The budget director, and you don't expect the budget director to have all the details, but he did not have the details or the answers that I was seeking in the committee meeting this week. And I don't fault him for that. But the administration has those answers somewhere. And we need to bring all the stakeholders together to sit down and find out what the facts are. Who's going to administer this program? How's it going to be administered? How are you going to provide transportation to those people in the hills and hollers so they can get to their volunteer services down at the public library or the senior center or wherever they have to go? There are serious, serious issues that need to be addressed, and yet it's not being talked about. So I call on the Bevin administration, I call on our leaders here in the majority party and our leaders in the majority party in the Senate to convene a meeting to discuss the facts about this important change in our healthcare system in this great Commonwealth. 95,000 people without health insurance because of red tape, ladies and gentlemen. Think about that, and think about it not just a quantitative big number, but think about it in terms of the individuals who are now jeopardizing their lives, or lives are being jeopardized by the leadership in this state capitol.